Hi, it's Andy here with another video that could save someone's life. And on this video, I'm going to show you how to perform CPR on an adult. We have to perform CPR when someone has a cardiac arrest. And there are around 250 arrests every day in the UK, so be prepared. Before we get stuck in, we need to assess the situation by using the mnemonic Dr. ABC or DRABC. Firstly, D stands for danger, where you're checking if it's safe for you and the victim. We check danger every day of our lives, but in a situation like this, your adrenaline's pumping and you tend to forget. R stands for response. Can we get a response from them by shouting at them and pinching their ear? If they're unresponsive, then they are unconscious, so shout for help. A stands for airway, and you need to open it and get that tongue out of the way. Do this by placing your hand on the forehead, moving the head back, and opening their mouth with your fingertips, lifting the chin. B stands for breathing, which you need to check that they are doing. Get your ear near enough to their mouth to listen, watch their chest to see if it rises, and see if you can feel breath on your cheek. Check breathing for 10 seconds. If they are not breathing normally or at all, then you have to start CPR. And when I say not breathing normally, in 40% of cardiac arrest cases, in the first few minutes of arrest, some victims have what's called agonal gasps. This looks like them moving their mouths and gasping for air. That's not normal breathing, and it shouldn't be confused with normal breathing, and CPR should commence straight away. Also, of course, make sure an ambulance is coming, and also shout for a defibrillator in a public place. C stands for CPR, so let's crack on. Place the heel of your hand in the center of their chest and interlock your other hand on top. Lock your arms and get yourself in a position so that your nose is pointing straight down at your hands. Press down on the chest around 5 to 6 centimeters and release the pressure, still keeping your hands on the chest. Do this 30 times at a speed of 120 beats per minute, or the Bee Gees classic, Staying Alive. Once you've done this 30 chest compressions, open up the airway again as before, and this time pinch the nose. Make a good seal between your mouth and theirs and blow steadily to make the chest rise that you can see. Making sure not to blow too hard, do this again. Once you've given 2 rescue breaths, repeat the whole procedure of 30 chest compressions and then 2 rescue breaths. Repeat this 30 to 2 on, and there's only 3 occasions that you stop. Firstly, when the ambulance crew arrives and they take over. Secondly, you become exhausted. And thirdly, they show signs of regaining consciousness, such as coughing or moving or breathing normally. So that's adult CPR. I really hope that's taught you something, and hopefully you'll remember it if needed. But of course, you can't beat learning it for real and practicing on dummies. So why don't you book a course with me and I'll teach you loads more life-saving skills. Goodbye for now. Go on buddy, finish now, get it now.